we saw the most horrific injuries, and the sort of injuries I never would have expected to see in my medical career in any hospital setting. We saw many children with catastrophic, often fatal burns. We saw many traumatic amputations, many severe blast injuries to the abdomen and the chest, and it was like hell on earth.
There was the number of casualties coming in, no one could cope with. You know, the triage couldn't cope with that kind of level of activity coming in. It's unprecedented. The hospital was filled to about 300% of its capacity, so there were inpatients everywhere, often with, you know, horrendous injuries. In addition to the patients, there were also relatives and internally displaced people everywhere. So there wasn't an inch of the hospital that wasn't occupied.
We were often incredibly short of essential supplies. So we ran out, on one day we ran out of sterile gauze to clean and to pack wounds. Another day we ran out of morphine, an incredibly important drug, particularly for trauma patients presenting with severe pain. We saw patients with, I've worked in conflict and humanitarian settings in other countries over several years. I have never seen the scale and severity of traumatic injuries sustained by the Palestinian people in Gaza. This was really of a magnitude greater than anything I've ever experienced.
If the world gets its act together, if our governments do force the Israeli to cease fire, and there is a Gaza to recover, then it will need the support of the whole world to rebuild it.